I'm Dr. David Brown, a peripheral nerve surgeon at Neuropax Clinic in St. Louis, and it's time for today's OR recap. Our mission at Neuropax Clinic is to rid the world of pain one patient at a time. So what did I do today? Well, my first patient had an amputation 5 years ago and described having pain in his toes that aren't there anymore for 5 years. It felt like crushing ice balls, he said. Within 30 minutes of arrival in the Neuropax outpatient clinic, we diagnosed him as having phantom pain related to injury to his sciatic nerve from the original amputation. We did an ultrasound-guided nerve block that proved that those nerves were involved, and today, through a small incision in the back of his thigh, I split that nerve into two pieces, the tibial nerve and the common peroneal nerve. We resected the nerve up higher in the thigh and wrapped it with skin graft and muscle graft in order to give the regenerating ends of that nerve somewhere to go rather than have pain later. I expect he will be pain-free and back to wearing his prosthetic within a month. Our second patient was a woman who'd had hip pain in the front of her hip right here in the groin area that was seen by multiple orthopedic surgeons, had x-rays and MRIs. Instead, what she had was a pinched nerve called lateral femoral nerve of the thigh. And some people call this Meralgia Paresthetica. It's essentially a compression of the nerve, just like carpal tunnel in the wrist. And so we made a small incision across the front of her hip, cut the tissues that are compressing the nerve that go to the leg, and give her relief of that pain. This nerve just goes to the side of the thigh to give sensation, but when it's pinched, can give a burning, aching pain that many people mistake for having trouble in the hip itself. And our third patient was another nice lady who had foot pain, this time from pinched nerve between the toes, that's called Morton's neuroma. It's not really a neuroma, it's a compression of the nerve. And because it was originally called neuroma, surgeons used to cut out the nerves to try to treat this problem and lessen the pain. But that created a real injury to the nerve where there was only compression before. So now instead, we make a small incision on the top of the foot at the base of the toes, spread the tissues, the ligaments that hold the bones of the toe together, and now that nerve has room to get good blood flow and breathe and stop the pain. So that's 3 down, 1 million to go. We at Orthopedic Associates Surgery Center and Neuropax Clinic would like to see you to help you relieve your pain. Give us a call. Visit our website at neuropaxclinic.com. We'll see you soon.